That's a very good question. So, I mean, there are many causes, from having an accident, trauma, so falling, being involved in a road traffic accident, skiing accident, something like that, infection, tumors, in any inflammatory conditions that people have, which can be autoimmune, can also affect the back. But the most common cause that I see is degenerative. And what that means is it's a normal cascade of wear and tear, like one gets in a knee or a hip when they get arthritis. The same concept applies to the spine. So the spine itself is made up of sort of a spinal unit, is the vertebra with the disc, and then another vertebra. And that disc, think of it basically, it's a mixture of proteins which absorb water, and it's like a grape. So it's big, it absorbs all the stress of daily life. But then after we reach our third decade, we start to lose some of those proteins. So the ability of the disc to do that diminishes. And then it leads to a cascade where the disc can fissure and bulge, it can pinch nerves, it can lead to back pain. And that's quite common. And how quickly that happens depends on many factors. You know, genetic predisposition, occupation, trauma, a multitude of things. But that is definitely the most common thing that I see. Normally, I would say sort of in the orthopedic spine world, you know, most things settle by about 6 weeks. Okay, so anything acute will be quite severe at the beginning, especially for the first few days, week or so, and then it will get better over time if it follows the natural history. And the natural history may take you to about 6 to 12 weeks, okay, until healing occurs. If the pain is still there beyond 3 months, 4 months, then I would say then you're in the realm of chronic pain. And that has its side effects, because chronic pain can then potentiate pathways and sort of become a vicious cycle where the pain gets worse because there's no release, there's no breakthrough. And it's really important that you seek medical advice and intervention before you get into that cycle. So, no, very good question. So, essentially, I think if your back pain takes more than 6 weeks and it's not settling, you should definitely seek attention. We talk about certain red flags. So, if you know you don't expect an under 18-year-old to suffer with back pain, that's quite uncommon. Yes, it can happen if, for example, they're sporty and they do certain things where they can develop like a fracture in the lower spine because of hyperextension, and that can happen. So with bowling, cricketing, gymnastics, weightlifting, but you have to put it into context. So if you have a child under that age that doesn't do that, then you have to think a little bit laterally. So I think, you know, if you're in an age group under 18, over 55, more than 6 weeks, definitely I would seek attention. Also, back pain tends to be mechanical. What I mean by that is it's there on movement. So when you take movement away, the pain settles. If your pain is present at rest or it's disturbing your sleep, that is a more worrying sign, or at least a sign that you should seek attention and let a specialist see you. So other causes could be a previous history of cancer. So things like unintentional weight loss, loss of appetite, loss of normal bowel motion, you know, normal sort of day-to-day things. Fever or feeling unwell in yourself could suggest an infection, and that could be a source of back pain. You could have a trauma or an accident, and again, you could maybe think nothing of it, but you may have sustained quite a more serious back injury. And I think lastly, if there's any change in function and control of your legs, your arms, or importantly, your bladder and your bowel. So if you're not getting that perception that I need to go to the toilet, but you're wetting yourself, or your control is different, or your feeling between your legs has changed, then definitely in these cases, I would not delay, and I'd ensure that you see a specialist immediately. It all starts off with a history. So take a history. When did it start? How long have you had it? What brings it on? What makes it better? And look at the past medical history. So something like a travel abroad or a recent intervention may suggest that there's an underlying infection, or a history of cancer, unintentional weight loss, poor appetite may suggest that there may be some form of cancer. And I think that will lead you down a certain path. But it all starts off with a detailed, targeted history, a physical examination, looking at the alignment of the spine, any areas of tenderness, making sure that the nerves are all working how they're supposed to. Any obvious lumps or bumps with a chaperone. And then you'd start off with full blood screen. So full bloods, so you could do tumor markers if you're concerned, infection markers, markers that tell you about the quality of the bone, because somebody may have osteoporosis or a low vitamin D, and that can cause back pain, that can cause bone pain. So I think it's looking at many different reasons. There are many metabolic reasons that can cause back pain, and it doesn't have to be infection or cancer. And then on top of that, it would be organizing a scan. So x-rays, so standing x-ray is really good. It shows what the alignment is when you're standing. An MRI, which is great for looking at the discs, the muscles, the facets, and also the ligaments to show us if there's been any recent injury, because that will show up on a particular sequence. I might get a CT scan, which is a specialized way at looking at bone. So if you're concerned of a fracture or something, that will give you fantastic information. And we have other scans like a CT SPECT, where they can inject you with a dye. If somebody has back pain, but I'm not sure where the source is, that may help identify a certain pain generator that may then be amenable to an injection or something else. And lastly, I think a DEXA scan, which particularly in the osteoporotic, somebody who's getting lots of fractures with poor bone health, will show us if that patient has osteoporosis. And then the treatment really is to treat that cause. So it would be to give them medicine to improve the quality of their bones so they stop fracturing. If you don't have any of the red flags we've talked about, I think at the beginning, it's rest and simple analgesia, simple painkillers. So an anti-inflammatory, if you can take it, naproxen, ibuprofen, diclofenac. You can rub it as a gel over the area that's sore. You can even put it as a suppository, so contact your GP. They're great because they don't have any systemic side effects, but they give you excellent local relief. You might get a low-dose codeine preparation over the counter, but that might constipate you. So think about supplementing with a laxative. I think if it's worse, you might need stronger painkiller from your general practitioner, or you may even attend A&E because it's so severe. But generally, it's rest, providing you don't have any concerning symptoms of any pain down your legs, your bladder and bowel is working, but you just have severe pain. You just need to rest it out. I've been there. I know it's not fun. You literally lie on the bed and it takes you half an hour to roll off. There's nothing pleasant about it, but sadly, there's nothing that can speed up that initial acute phase. After a few days, it gets better. You might support your core by using a little belt or a brace, just because everything's in spasm, so you don't like bending, and it just gives you added support. Once the pain gets better, the emphasis is on just keeping mobile. Walking, but no aggressive physiotherapy, because then I think you'll set yourself back. And it's just walking, keeping agile, being mindful of your posture. If you bend down, to bend your knees and keep your back supported. And know that you increase the greatest pressure when you lean forward and you hold a weight further away from you. So anything, hold it close to your body, low weights, support your back. And if it doesn't settle, come and see a specialist.